Hello. Welcome to Facebook Live on a Wednesday. Red flags in plastic surgery is what we're going to talk about. You may be noticing I'm wearing a bit of merch, a little bit more merch here. I've got the t-shirt on, and we will be giving away some of this merch tonight. So for those of you who are watching, all you have to do is write giveaway in the comments below. You need to do it before 8 o'clock. And right at the end, I'm going to be making the draw. So if you put your name down and you're on at the end and your name gets called, send us a DM with your details and we will send you some re-merch. And just a little bit of a heads up, we're going to be putting some of that merch on our website for people to buy. So opportunities to still be part of the Re family. We've got a lot of people already on. Hi, Maria, Lorraine, Jess, Kelly, Kat, Lydia, Sophie, Mel, Angela, another Mel. So very exciting, and I can see already a few people have typed in getaway. So I will be reminding everyone, entries close by 8 o'clock, and I'll make the draw at the end. So it's going to be a great night. We're talking about red flags, one of our favourite topics, and one of the most frequently requested topics that we get in our quizzes. So very important. Obviously, we'll be doing Q&As. So if I don't cover something and you've spoken to a plastic surgeon or you know of someone who has spoken to a plastic surgeon, then please put that down. And remember to put a Q in front of your question. So at the end, I'll be able to find the questions easily and go through them. I'll also go through what's coming up in September. Who can believe it's September? What has happened to this year? I'll also go through how to find out more about me and Kim and Ree, and then right at the end, as I said, we'll be drawing the prize. So if you missed the start, we'll be giving away some merch. This hat, there are keep cups, and some t-shirts, and these are the t-shirts that the staff are wearing at the moment, and I've been wearing today consulting. So part of an even bigger part of the Re family. So very exciting there. So safety in plastic surgery is paramount. We're doing elective surgery. Obviously, the outcome is also critical, but you need to do it in a safe way. And when you're going for a consultation, whether it's with us here at Re or somewhere else, or you've got family going for consultations, everyone wants to know, how do you know you're going to the right person? What do you ask? What are the most important things? So tonight I'm going to go through some of those things for you and try and explain it. So this is an article that was in the papers just last week, and really highlights why this is such a big problem. And the problem in Australia is that any doctor can use the title surgeon. So you can be a family doctor, no experience, no training, not recognised by any specialist body, no exams, and you can call yourself a cosmetic surgeon. There's been long battles trying to correct that. The government aren't particularly interested. They see it as anti-competitive, as ridiculous as that may seem. But they're the facts. And so, unfortunately, it is on you, the patients, to do your own research. Now, this has actually become very topical on Netflix, and someone in my office put this together for me today. I'm not sure if it's fair, but the series Dr. Death has really highlighted or brought to the attention, doctors doing bad things. And believe me, it does happen, and it happens in Australia, and there's a high-profile case which I'm not going to go into the details of, but currently playing out in Sydney. But we see it here as well. So someone in the office thought this was funny, that I was a bit of a Robert Henderson. If anyone hasn't seen the series, that was the character played by Alec Baldwin. Personally, I'm a bit more of a Randall Kirby, which was Christian Slater, but great series, bit scary. Maybe don't watch it if you're about to have surgery. But it does highlight the fact that some bad doctors do get through. And so you do need to be wary and look out for things. So what are the things, and we've gone through this before, but it's always an important topic, and I'm going to put a slightly different spin on it to previously, but these are my red flags as they stand. So when you see a surgeon, and particularly when you're seeing me, I will always discuss alternatives for that particular procedure with you. So when I'm talking about a breast augmentation, I will talk about the different types of implants. I'll talk about the different sorts of approaches, and I go through why I choose the particular approach, the particular implant, the particular size, whether it's a round, anatomical, why I use an inframammary fold, why I go dual plane. I discuss all of those things. I'll talk about a round implant. I'll explain, if in your case, why that is not the best approach. And I even, if somebody comes in and I don't think a breast augmentation is the right operation for them, I will explain that that's not an appropriate operation. So when you're seeing someone, I think it's important that they explain the different alternatives. And I mean, it applies equally to a tummy tuck. Those of you who've seen me, not for all cases, but in some cases, I'll discuss a tummy tuck versus a body lift. I'll talk about maybe a fleur-de-lis and why maybe that's not appropriate. I've talked about that just today with a patient. I'll talk about liposuction, that role. I'll also talk about whether it's appropriate for you to have that operation at this time. I had that discussion as well today. Breast reduction. I'll explain why I do an anchor type inverted T incision. I'll explain the vertical incision. I'll explain why I don't like that approach and the problems that I see from that approach, and why I think the approach that I'm doing is better. But the important thing is I am always discussing the alternatives, even alternatives such as no surgery. So number one red flag for me would be discussing alternatives. The next, and this has to be part of every consultation, for mine, it probably takes up, it's about probably a third of my consultations. I go through all of the risks and complications. But importantly, I explain them relative to that operation and in my experience and my hands. So I'm not just talking about general complications. I'm talking about what I actually see, what I have actually experienced for each particular operation. Now, it'd be great if all surgery had no risks, but unfortunately, that's not the case. And so it's important to discuss them, put them into perspective, explain what you would do if such a complication occurred, how that would be treated, how that would be managed. Many of you who follow us regularly will know that Kim and I have just introduced a policy that covers patients for most of the common complications for a period of 2 years from your surgery. We knew that that was a big pain point for people, particularly those who are self-funding and not insured. And so that's some level of reassurance. Overall, for significant complications requiring urgent return to theatre, it's probably under 1%. So those are things like, most common thing is it would be an early postoperative bleed. Other things like wound healing issues, seromas, build up of fluid, almost not even a complication with a tummy tuck. It's kind of almost part of the process. Dog ears, things like that. We discuss all of those things as part of the consultation. If you're in a consultation and someone claims to have never had a complication or doesn't discuss them, big red flag. Everyone sadly has complications, and it's not about not having them, it's about knowing what to do if you have them and getting everything back on track so you get the result that you're expecting. So, all right, so that is red flag number 2. I think I've got 6, so I'm going to keep going. Remember, if you've just joined, we do have a competition running, so you need to type in giveaway into the comments below, and I'm going to be making that draw at the end of the live, and you need to be on the live at the time to collect the prize if you do win. So my next red flag is to know how long someone has been in practice, and in particular how long they have been in practice doing the surgery that you want to do. So I have been a plastic surgeon since 2003. Wow, nearly coming up to 20 years, and training for 5 years before that. So I've been doing it quite a long time, and I've always been doing tummy tucks, body lifts, body contouring, and breast reduction surgery. So not only have I been in practice for nearly 20 years, but I specialize in the areas that I work in. So I'm not spending half my time doing road trauma. I'm not doing trauma on call at a major hospital. All those things are great, but it's like asking a truck driver to fly a plane. Okay, you wouldn't ask a truck driver to drive a plane. They're both fly a plane. They're both highly skilled jobs, but they're different. Some of the principles are the same. You've got to not crash, and you've got to be alert for everything, but they are very different. So that's what I do. That's what Kim does. Breast surgery, tummy surgery, body surgery, and we've both been doing it for a long time. So at some occasions, it's great to give the new kid on the block a go, but probably this type of surgery is not one of those occasions. So if you are seeing someone in your family seeing a surgeon, a good question to ask is how long have they been doing this type of work, the work you're interested in, as well as do they actually specialize in this type of work? So if somebody has been out as a specialist plastic surgeon for only a few years and they're doing a lot of public on-call, or they do a lot of hand surgery, or you walk in the waiting room, there's skin cancer patients and a whole lot of other things, that's probably not where you want to go for your breast reduction. Alrighty, so that is red flag number 3. Red flag number 4. So this is specialist registration. So very, very easy to work this out. You go to apra.gov.au. Now, I haven't done this before, so hopefully I come up. I am going to type in my name. This is all live. Have I come up? Autumn Bloom, Lisa Bloom. Oh my gosh, I'm not there. Surely I'm there. Here we go. I never knew there were so many blooms. I need to... Hang on, where am I? Damn it, I'm not registered. Here we are. Okay, sorry, jumped ahead. Okay, so this is what you need to find out. I am registered. I've got no conditions on my registration, no reprimands, no undertakings. And this is the important part. You scroll down here. I am a specialist. And I'm a specialist in plastic surgery. And I did update this today. I was a bit sneaky. I'm actually registered for until end of September next year. I've got no endorsements, notifications, nothing else. I'm male. I've got a medical degree, and I practice in Toorak. So how easy is that? That's all you have to do. And that is one way to get around whether you're seeing a GP to do your tummy tuck. Go to the APRA website. If you've got friends and family who are thinking about plastic surgery, tell them to go to the APRA website. You will know if their registration ends at general, that's all they are. They've just got a basic medical degree. I'm going to the background of why this has come about, which I'll do. It is Kirsten just asked, what's that page? It is at the top there. Can I scroll that? I can't scroll it. It's stuffed everything up now. What is it? ahpra.gov.au. I'll respond to your question after the show, and I'll type it there for everyone so that you know. The historical side of this is we all do a basic degree, which is an MBBS, which stands for Bachelor of Medicine, Bachelor of Surgery. Historically, that allowed country GPs to perform basic surgical procedures like ingrown toenails, maybe appendix, hernias. Obviously obsolete now, no need for it. But the powers that be still allow that title of surgeon to be used by non-surgeons. So to become a surgeon, just go over it again, it's about, you have to do all your basic medical training, 6 years, you work in the hospitals another 3 or 4 years, you then get into a specialist surgical training program. In my case, I did a couple of years of general surgery and then switched over to plastic surgery, did another 4 years. So I think I'm up to, 10, 12 years. And then do specialist exams, passed them, and then I went overseas as well and did some training over there. So compare that to a cosmetic. I can't even say the other S word after that, but someone who's not a surgeon who does this sort of thing, they did the first 6 years and then started practice. So fair bit of difference there, but that is the overview. All right, the next one, and I'm particularly passionate about this because we put a lot of effort into this, and thanks goes to all of our nurses who have been how would I put it? Been trained. Let's just put it that, been trained by me predominantly to take the photos in a very, very consistent way. And I had a patient today who I'd operated on 6 years ago. I could bring up her photos. We could find them. They're great quality. Compared them to her current day photos. And you could absolutely compare apples with apples. And so when you look at photos and you can tell the lighting's wrong, the proportions are different, the angles are different, the colors are different, that also is a red flag for me, because when you're deciding on your surgeon, one of the important things is looking at before and after photos. So if someone is a bit lazy, not only is it a bad reflection on their general practice, but if someone is not taking photos and not showing you photos, I mean, we've got a catalogue, I think we're now up to 50,000 photos between me and Kim. We've got so many photos that I had to actually make more space on our hard drive to cater for all of them. we can pretty much find for any body type, breast shape, we can find a similar patient and show you a representative result of what you might expect for the same type of body. Again, had a body lift patient today, and she'd lost a lot of weight, but I was able to show a number of patients who had very, very similar features and show her, and she has a different, I'm not sure if she's watching tonight, and hopefully she is. I was able to find a similar patient who'd undergone a similar operation, who'd lost a similar amount of weight, and give an idea of what sort of result that she could expect. So before and after photos, firstly, make sure that they show you. Secondly, make sure you see photos of the operation that you're having with a similar body type, and make sure they're good quality, because bad quality photos can camouflage a lot of poor outcomes. So that's another red flag. No photos, no surgery for me. All right, so I think we're up to the last one. Now, before I get to the last one, remember, if you haven't entered already, type in, we've got a competition, we're giving away a bit of merch. I can't say exactly what it's going to be, but it's going to be one of those things. Pop in giveaway down below. You need to do it in the next 9 minutes, and you need to stay on the live so that I can call your name out and you can send us your details. So the last one is websites, socials, and reviews. I think patients in 2021 are very lucky in many ways, because there is just so much information. I'm going to go through later what we provide, but there's so many different ways to find out and do research. 10 years ago, there was really, other than a GP referral, and no disrespect to GPs, but they don't really know who is good at doing this surgery and who's not good at doing this surgery. But that was really, and a bit of word of mouth, but people didn't really talk about this type of surgery so much. But now you've got the fortunate position where you can, every surgeon should have a website. You can find out a lot of information about your surgeon. Most surgeons, certainly we do, have before and after photos on there. You can find out their qualifications, all those sorts of things. You can, so most surgeons, if not all, will be on social media, Facebook, Instagram, YouTube. You can find out pretty much everything about them, engage with other patients, which I know a lot of our patients do through our Instagram and also through our Facebook group. So you've really got no excuses not to know everything about your surgeon. So if you get told about a surgeon, you can't find them on social media, you can't find a website, that's a bit of a red flag for me. Also, Google reviews. Unfortunately, when we can't put up our reviews, that goes against some antiquated APRA guidelines. We'd love to share them with you, but you certainly can find them on Google. We're not allowed to, this is wild. We can have Google reviews because you can't turn Google reviews off. You can't have Facebook reviews because you can turn Facebook reviews off. So the powers that be insist that we turn them off. Thankfully, you can't turn Google reviews off, so they are there for people to see. And you can't change them, the good, the bad, the ugly. You can't, you can ask Google, but I don't think they take down reviews very readily. So check out a surgeon's website, check out their social medias, check out their reviews. All right. So I am going to go through some Q&As. You have 6 minutes left to enter. I'm going to type in. Right, I don't think there are any questions. Is that possible? I am scrolling through. Great to see so many people on. Yes, Bianca, there's a hat. Make sure you have. A lot of people have entered. No, I can't see any questions yet. So you're running. I can't believe I've never. Oh, we've got the ARPRA. That's good. That is up there. So we've provided that ARPRA website for you. I can't see any more questions. Oh, here we go. I think that's more of a statement. Okay. All right. No question and answers. Wow. I'm a bit disappointed. Can someone ask one question? Anything. All right. All right. No questions. All right. So what is coming up? It is September. Finals are upon us. Sadly, not in Melbourne. But it is September. Spring is in the air and we have got lots going on. Obviously, my Facebook Live tonight. We've got a podcast, a special Father's Day podcast. Although we've got a Girls group, we do get a lot of questions. I was asked today from a patient asking for a friend, I think maybe a husband, whether we do male surgery. I've actually operated on, I think I've done two men this in the last week or so. So we've got a podcast coming up all about plastic surgery in men. So that is a good one. Kim's next Facebook Live is all about excess skin removal. So that'll be a great one. We've then got a Insta Q&A about thigh reductions. And then our next podcast will be, it's a five Wednesday month. So we love our 5 Wednesday months. And then we've got a podcast with our dermal therapist, Sophia, and she is talking all about maskne. I think that's what happens to your skin when you're wearing a mask too often. So we all know about that. Hang on, we've got a question. Are consultations in person at the moment or just via Zoom? We both. So up to you. As a medical practice, we can see patients, but if you'd prefer Zoom, I can tell you the vast majority and soon to be all of us are vaccinated. So we're all wearing masks, we're socially distancing, we're getting everyone to check in. We do ask that obviously try and minimise the number of people in the office, but yes, we are seeing patients in the office. I'm not sure I do, Kate, but thank you. I try my hardest. Bianca, thank you. I know, Doogie Howser. I'm the Doogie Howser of plastic surgery. All right, hopefully people know what that is. Maybe they don't. All right, I skipped ahead here. I was mentioning before, if you're going to check a surgeon out, check out their socials, and this is the best place to start. We're creeping up on 10,000 followers. So if you know anyone who's not a member, who hasn't joined our Instagram, please, and they're looking for plastic surgery, please get them to join. I think the information we have now on our Instagram is second to none. A lot of practices just go for before and afters and glamour shots. We try and do a bit more education and a little bit more personal, and we have been getting into the gory vids recently with appropriate warnings, and I hopefully everyone has been enjoying that. There's 1 minute left. It's 7:59. 1 minute left. type in giveaway if you haven't done it yet, and we're going to be drawing that very soon. Join our social media. Give us a shout out if you're enjoying the surgery photos. I do try and do it and keep it as clean as possible, but I think people do love it. I mean, it's so exciting to be able to bring you into an operating theatre. So there's that. Medispa, so that has been relaunched. There's going to be a whole lot of new content coming down there. So, and we've got Sophia, who's just joined the team, which is really exciting. She posted some Q&As yesterday on. Hang on, I've got to go back. If you haven't checked out the day in the life of both Kim and I, make sure you check that out. That was a lot of fun to do. We're going to be doing more of that. Back to Medispa, Sophia, she did some Q&As yesterday. Hopefully they will be stored in our stories and you can review them. But she got through a lot of questions and we'll be doing more of that. And obviously the Girls group. Last time I put that up, I've just done that now. We're at 1.7, so we've had another 200 Girls join, which is just awesome. Barely a day goes by where I don't hear from one of our patients about how great that group is and how much benefit everyone gets out of it. So there are a couple of other questions. B is asking about botched. Yeah, we do from time to time have to fix other surgeries. We have done a podcast on botched, but it's always a popular topic. Sasha wants to know, how many would you... It depends what the surgeries are. So some surgeries you can combine, some don't go so well together. I generally can do about six or 7 hours at a time on one patient before it is enough. Sophie asked, that's an important question. Currently, you don't have to be vaccinated to have surgery, but it wouldn't surprise me if that was something that came in the near future. So certainly not a requirement now, but who knows over the coming months whether for elective surgery that will become a requirement. Okay, next, as I was talking about, websites. So we love our website. If I click up here on results, I think I go through this every week, but you can scroll through here and look at different results. I'm looking at breast augmentations at the moment. Then within that, you can look at, this is obviously a revision case, and there's too much implant in that case below the fold, and so we corrected that. But you can go from here, you can go to Mummy Makeover. Hopefully that'll load, and yeah, you can see all different, obviously implants as well. So plenty of before and afters. You can find out everything you need to about us from there. And then our YouTube channel. So if you know someone who might find this interesting, I'm actually streaming on YouTube and Facebook at the moment, which I haven't done that many times, but you can jump onto...
doesn't mean anything. Doesn't mean there's a problem.
This was from. But you can jump on. We've got 138 subscribers, so that is growing. Facebook Live, you can see their red flags there is running, but all of our Facebook Lives will go up there, and there's heaps of other videos talking about.
Often when I ring family, the most common thing I hear is,
all right.
It's taken longer than I expected. So I'm not quite sure how long anyone expected.
I think the people who are doing flying through recovery
operations take as long as they need.
I get the impression that it's all smooth sailing, And the people who are maybe having a bit of a harder time.
If you don't have
they do
implants
post
and
as
you
well,
have a revision,
maybe a bit
you
less
still make an
prolific,
internal bra.
and so you can
Unless
get
you
the
have a revision
impression
next
that it's all just
well,
the same.
as I said,
So I think
no matter what
need to
breast
have a
surgery
bit
I'm
of
doing,
perspective
I
about
do
all
a
that.
form of internal bra, whether it's supporting the breast tissue or supporting the fold.
That was the
Generally
podcast.
both in breast reduction.
Now I'm just trying to get up our wheel
yes,
of. Oh my gosh! Hang on. All right.
How common is
Watch
the
out.
mesh bra?
Here we go. That was the
Nikki, I'd
podcast.
probably
We are up to
say I
episode
use it
43.
maybe,
Can you believe it? That
10% of
is a
cases
lot of listening. They all go for about
overall,
20, 30
certainly
minutes. So
overrepresented in
that's
the
maybe
revision program,
20
exclusively
something hours that you can listen
revision
to me
breast
and Kim.
augmentation cases.
We love, mate. We
There's
recorded
no need to use
two
primary augmentation
new ones
and
last
no need to
Thursday.
use
I know
breast reduction.
Sophia's done some, and we've done some with patients.
Some surgeons
that are all coming up over the next
do use it
little
in the
bit.
situation where
Again, if you have any ideas, recommendations, suggestions, please drop them below or
Not really
drop them in the
practice here.
comments on
we don't get
Apple
that request that
Podcasts.
often.
Alrighty,
It's probably not
so
a bad idea,
it is
because
competition
the
time.
weight
Remember,
size implant
you
is
need.
almost certainly
Look at those names.
going
We've got a
to
lot of
stretch
names
the
there.
skin, beyond, what
YouTube
it's
is playing in the
capable
background.
of.
Let me get rid of that. Has that stopped it? I've stopped that. I'm going to mute it. There we go. It's gone. I don't know what I was saying. Hopefully it was interesting. So we had the podcast going and the YouTube. Sorry about that. There's always a glitch. So look at all those numbers. Look at this wheel. How cool is this? So I am going to... Who's excited? Who is excited? We've got the merch, this cap, and a few other different things that will be available. And all I need to do, I think, is click this. No, I need to click it here. Oh, and we're off. Who is it going to be? This is exciting. Wow. Lydia. Exciting times. Alrighty, so Lydia, before I announce you formally as the winner, can you just message, put a message that you're still there, because it has to be someone on. Yep, you're there, Lydia. You are our winner. Lydia, all you need to do is just send us a direct message, and you will be the proud owner of some merch, which will be coming for purchase on our website very, very soon. So that is it from me. I think it's Kim coming up next week with another podcast, and then Kim. Hope you enjoyed it. Hope that was helpful. I love doing it, and I will see you back here again in a month's time.